push this button. So welcome everyone to our seminar about the children with PKU in Palestine. Our team, Rebuilding Alliance, I'm the executive director of Rebuilding Alliance and the founder. And our work in this area comes because of two children it was two small children that their mom really asked that we help with getting the special medical formula, the medical food to them. And we'd been doing that for about a year and a half. And suddenly Dr. Kimberly Young, who's on the call, said, wait a minute, I'm from a family who's experienced some of this. There probably are more children than two in Gaza and the West Bank. And so Dr. Kimberly said, let's go find them. And so we have. And then we found more than what we were looking for, and that's why we need your help. So we'll be presenting with some background about what this is all about, and then from the West Bank and from Gaza. But first, I want to turn to Reverend Fahed Abu-Akel. I'm very proud to say that he has been on Rebuilding Alliance's advisory board from the very start of our organization. And I was always too shy to talk to him because I thought he was such a famous person, like the Pope, a moderator of the Presbyterian Church. I'm really honored to say that he's born 25 miles northwest of Nazareth in Galilee to Palestinian Arab Christian parents in the village of Kufr Yassif. He is certainly an inspiration to everyone who's worked with him. He's actually, your bio is too long, Reverend Fahed. I'm just going to let you go ahead and speak. Please, I'm so proud to have you on this call.
I want to say special thanks to you, Dana, to your staff, and also to all the volunteers and all the people who are working in the West Bank and in Gaza. And I want to say a special welcome to everyone joining us. And I think we are recording this, so we need to send the information to everyone. When I think about the Rebuilding Alliance, which is a nonprofit organization that began in 2003, and imagine Dana is an electrical engineer, moving from electrical engineer to care for people in grassroots Palestine. To me, I want to support her all the time. They are based in Palo Alto, California, and the mission of this organization is advancing equal rights through education and advocacy. They need our support for the simple reason I discovered about this event today, that there's an organization is going to support us dollar for dollar, up to $15,000. Imagine during COVID-19, somebody to tell you, I want to give you $15,000. I think each one of us need to take the message to everyone we know. We need to reach the $15,000 one way or another. I don't know how long they gave you, but I hope everybody will pitch in, because we are dealing with a crisis and they will explain about it. And that is called PKU. Imagine if they don't get that kind of a medicine, it will affect the brain, it will affect the future of a child. So we are honored to have you here, and I hope you can spread the word about the Rebuilding Alliance. Thank you for coming.
Thank you so much, Reverend Fahed. Really great to have everyone on the call. And let me go forward to introduce our guest speaker, Agata Bak, who is coming to us from Mexico on this call. Agata is an adult with PKU, a Ph.D. Student, and and certainly someone who's been instrumental in the PKU societies in Spain and also in Europe. I am especially impressed because Agata was the one who opened the door through her own experience when Poland was first learning about PKU. And so it's her, she's one of the key people on our Tiger team who informs the team and who's really helped us look deeper and deeper and resolve issue after issue. We're very proud to say, just before you start, Agata, I wanted to tell everyone that our first shipment did arrive both in the West Bank and in Gaza. And distribution starts, that was tested out today, and it's starting for sure tomorrow. And this is a big challenge during COVID, but it is doable. We can manage this. And so we bring you this attention so you'll learn more and help us extend this again through the matching grant from 1 day's wages. So please, Agata, go ahead. Tell us about yourself and what is PKU?
Okay, thank you, Donna, so much for the introduction. I hope you can hear me. Thank you. I want to thank the Rebuilding Alliance also for hosting this event and for taking care of this situation. It is very important for me for a reason I will try to explain right now. And well, as the reason I'm here is that apart from being PKU, I volunteer for both Spanish and international organization for PKU. And there is where I met first Dr. Akram, who is not here with us. He's from Gaza, and he works for Brilliant Future Association, one of the association in the area I knew, and Dr. Red Hindi, who is here with us and who will deliver the speech after. And I think this kind of commitment, a kind of debt I'm paying forward in a sense. I will explain that later. But yeah, first of all, so I really appreciate you are here, and I'm really happy that we can talk about PKU for a while. So let me start by saying what is PKU and what life with PKU is, and what we require actually to live it with a good quality of life. PKU is an inherited metabolic disorder. It means that it appears from birth. It's something genetic, okay? And it is a rare disorder. It means it affects not so many people in the world. And it has some series of problems associated. Mostly they have to do with, public health issues and so on. PKU is a disorder that consists of a bad expression of one gene, and it causes that we lack certain enzymatic activity that breaks down protein, okay? In particular, there is one amino acid in protein called phenylalanine, which we cannot break down. Now, because we cannot break it down, it accumulates in the brain, first in the blood, then it goes to the brain, and basically it causes several brain damage. It means that if it's not detected from birth when it starts, children or newborns will have several cognitive and physical impairment. They won't walk, they won't speak. It depends on the severity, but really the quality of life is really poor. Now, fortunately, we have measures, we have tools to detect it from birth. Both in the US and most of the European countries, we have newborn screening programs. It's the famous Hill prick test you possibly have heard about, or your children have been performed such a test. And it detects a concentration of phenylalanine at birth. It means that we know about the disease before the symptoms appear, and we can start a treatment, okay? Now, there are two basic pillars of the treatment that has to be introduced in PKU diet, or in PKU treatment. The first one is a low protein diet. And when I say low protein, well, you normally think about meat and fish as a source of protein. But the truth is that almost everything has protein apart from pure sugar and pure oil. So we count mostly everything, like every vegetable, every fruit, okay? After a while, while you're living with PKU, you more or less know that there are fruits that are low in protein and you just don't have to count them. But counting it means you exclude from your diet, so meat, fish, dairy products, flour, eggs, legumes. I don't know if I'm missing something, but the diet is extremely, extremely restrictive, okay? We have some low protein food. It's a food for special medical purposes that has been manufactured by different pharmaceutical companies. So we get, for example, special flour or special cookies or special milk, okay? But it's it's manufactured for special purposes and it has its price, obviously. So that's the first pillar. The second pillar is the special formula. And this is something we've been trying to solve right now in Palestine, yes? The formula, it's a blend of amino acids, like it's the whole protein we don't get from normal food. Apart from one amino acid we cannot eat. Because of course, if you are on such restrictive diet, you are in risk of like grave, severe malnutrition problems. So the formula, what it does, it supplies us with all the necessary nutrients so that we can, develop properly. The diet itself is very difficult. There is also Sarah Foster here, who is another PKUer on board. And, the testimony, well, it's difficult. It's difficult to organize the diet, for the child to understand the limitation, for the parents to teach them about what they can eat or not. It is difficult to go outside and eat because there's nothing you can eat sometimes, at the street food. It is difficult to organize yourself. Like, for example, my diet, apart from fruit and vegetables, would allow me for 1 yogurt a day or half an egg, okay? So we are talking about this. It's fruit, vegetables, special formula, which is not great in taste. I can tell you it's, well, challenging to take sometimes. And special foods. So as you can see, it's challenging on many, many levels. Now, if the diet is discontinued for some reason, the brain has already developed a bit, but there will be consequences, okay? If it's discontinued at the age of 10 or 12, the children will have problems with focusing, they will have problems with self-aggression, they will have problems on many, many, many levels, okay? And this brain damage is also irreversible. In adults, if you discontinue in adults, you will present problems with cognitive functioning, like, focusing, planning. You will have problems with anxiety and depression, which will be physiologically induced. You will have a lot of problems and a high risk of some other neurodegenerative diseases. So it is now widely recognized that we need a diet for life, basically. Okay, the diet and the formula. Now, as you can imagine, to be a healthy person with PKU requires a lot of support from the state. The diet, well, the process of screening, the process of detecting PKU depends on the state programs, basically, because they screen massively the whole population. The support for formula, which is extremely expensive, as you could see from our page when we were trying to calculate the cost of diet per child, is also extremely expensive. And in Europe or in States and in other countries, we are surviving thanks to national healthcare programs or insurance programs, basically. So this is possible thanks to robust state programs. It is like that, basically. So it is extremely challenging and worrisome for me to see that there are zones when this is not happening. As Donna said, there was my Polish experience coming. My Polish experience is that I was born in Poland. I'm of Polish origin in the 80s. And it's not the best moment to be born with a rare disease, okay? Let's say it this way. So I was detected in a good moment, but there were a formula shortage. We had problems with low protein food. There was, it wasn't functioning on a state level. So what we did was to associate, my parents, my grandfather, and we desperately looked for help somewhere else, okay? My grandfather himself, he was a translator. He went to Sweden, like to ask or to beg communities to consider to donate us some funds or some low protein products or some formula, because there was a formula crisis at some point. And we achieved that. And I must say that I am fine, that I can research. I am now trying to, incorporate myself as a university researcher, because I was given that chance. Okay, I was given. There was a Swedish community, a lovely community that was knitting, that was selling, they were selling some kind of artifacts, and with that money they were buying flour, okay? And this was really something that helped us, the whole Polish community, to get low protein food, bake low protein bread, and buy formula when there was a shortage. And I thought, and I'm always thinking, that this is something I owe to the people that once helped me. And this is why also I'm here. I think I'm really committed to the idea that we should help to solve such crises, yes, both on direct and personal level, like trying to provide them with formula, as well as, in a long term, trying to find solution on different levels, more institutional maybe. So that's why I'm here. And I am extremely happy to see you all. And I thank you all for coming. And that will be all. Thank you.
Thank you so much, Agata. Were they knitting, did you say? Like they were creating things so that they could sell?
Yes, it was something like that. They were selling scarves and sweaters, yes. And once in a year they would buy low protein flour from that, and they were sending that to Poland.
Wow.
Yes.
It's really wonderful.
It is.
So thank you very much for that introduction. And I just want to take a moment before I introduce our next speaker to tell you who else from our Tiger team is on the line. So when Dr. Kimberly had pointed out, she's been following her Building Alliance's work. We did a special event together, and she sort of noticed this little notice on our website. We hadn't been very complete about it in our new website. And she noticed that we were sponsoring 2 children in Gaza. And she said, there's got to be more. So Dr. Kimberly is part of our Tiger team. Also, Paula Rainey has joined our Tiger team. In addition, Sarah Foster, Agata Bak, and then our speakers that are coming up, Dr. Raed Hindi and Dr. Amjad Abaza. And then we've got the Gaza team, whose looks like their electricity is not holding up. So we might not be hearing from them, but we just met with them this morning. The team gets even bigger than that, and it has morning meetings every Sunday. And as you're going to hear, what we're learning is actually still every Sunday, we are learning something that is very troubling and of concern. And luckily we're responding. As we went through our first fundraiser, we didn't get to the full goal. And so some parts of our team said, maybe we had to do some form of triage. Maybe we should only help some of the children since we can't help all of the children. But I said, no, we've just got to keep going, that there will be a way. And as we go through each step of this process together, there'll be more and more people who will help us. So I really do believe that's true. Dr. Raed Hindi, I get the honor to introduce you. Dr. Raed Hindi is the chair of the PKU association based in Bethlehem, the Charitable Association. which he's formed. He's the father of a PKU son, and he's a dentist working for the Palestinian Medical Relief Society, as is Dr. Amjad, who's a dentist with Palestinian Medical Relief Society. Very exciting to have their insight, both in their determination to stand by these families to make sure that governments and people around the world can respond, because these are big challenges, and it's not the easiest time, of course, like Agata and solidarity times. It wasn't the easiest time to resolve it. Now we've got the COVID times, and we've got those challenges. With no further ado, let me introduce Dr. Rad, who will be speaking in Arabic, and Dr. Amjad, who will be translating, his good friend and our team member. So Dr. Rad, tell us about why you formed the Charitable Association, and tell us about the formula coming and how are the families responding? What's it like in the West Bank about the formula? And you might be talking about Gaza too, but we'll get to that in a minute. First, tell us about what you're experiencing. What are the challenges you see? And Amjad, you might translate.
Yeah. دكتور رائد تسألك إنه شو السبب اللي خلاك أول شيء تكون مؤسسة البي كيو في بيت لحم، وكمان شو وضع البي كيو في مرضى البي كيو في ضفة حاليا، وشو التحديات اللي بنواجهها كمؤسسة وفي أطفال بيعانوا من البي كيو.
بالبداية مساء الخير للجميع. نشكر جمعية بيلدينج ألاينز لاهتمامها ودعمها لأطفالنا المرضى في فلسطين. نشكر جميع المتواجدين بشكل عام والأصدقاء الشعب الفلسطيني في كل العالم. بخصوص سبب تأسيس جمعية البيكيو عندنا في بيت لحم وفلسطين، أنا قبل 3 سنوات ونصف عندي كان طفل مريض بيكيو، ابني صغير. فلما سألت الأهالي والأطفال، أغلبهم كانوا من الناس البسطاء، ما عندهم معرفة، ما في متابعة دائمة لأطفالهم، ما في تثقيف كامل. الحليب كان كل فترة ينقطع للأسف الشديد لأسباب كثيرة بسبب الوضع في فلسطين. فكان من هون سبب تأسيس الجمعية لتوفير الدعم الممكن للأطفال اللي يعيشوا حياة كريمة مثل باقي الأطفال، لتجنب المضاعفات اللي ممكن تحصل لهم.
Okay. First of all, good afternoon, everyone. We thank the Rebuilding Alliance for all of their efforts and all of the work they have done and are still doing, and helping us in every way possible. Dr. Rad is saying that like the first idea to get this charitable PKU association established was when he got a child like 3.5 years ago, and his child was diagnosed with PKU. So that made him like search more about this disease, and like ask around the community, and ask like the other parents of the other children that are affected by this disease. And that made him realize that there isn't much of like awareness about this disease. Like basically, like they don't barely know what they're doing. They don't have enough information about how to deal with these children, because they do require special treatment, or how like to properly feed the children, whether it is the formula or the normal food they're taking. and what diet they would go on, because they also require special diet, or otherwise they would get some like mental diseases and retardation. So he decided that he would establish and um, establish this PKU charitable association that is currently located in Bethlehem, and it is the only PKU association in the West Bank. So he started it, and the basic goals of establishing it was to work more on raising awareness among the community about the PKU and about the challenges the children are facing in our community, and how to deal with them, how to treat them, how to get them to their appointments, how to like generally take care of this child with PKU.
بخصوص التحديات التي تواجهنا في الضفة بشكل عام وغزة كمان، أهم الأسباب عدم توفر الحليب بشكل دائم لأسباب ممكن مادية لتعرض السلطة الفلسطينية للوضع الحالي السياسي، الحصار، لتوقف الدعم الدولي عنها. السبب الثاني إنه في عنا المرض من 50 عام مكتشف، لكن لحد الآن الغذاء الخالي للبروتين أو قليل البروتين غير متواجد في فلسطين بشكل عام، وإن توفر أصناف قليلة جدا وغالية على الأهالي والأطفال في ظل الوضع الحالي الاقتصادي السيء. الشغلة الثانية إنه الوضع في غزة لسه أسوأ بالضفة الغربية، الوضع برضو الوضع اللي هي حاصلة فيه. عندنا كمان المشكلة ما في أخصائيين متخصصين لهذول الأطفال لمتابعتهم، متابعة حالتهم. كمل وأنا بترجم.
Okay. So Dr. Rad is talking about some of the like challenges that these children who are suffering from PKU are facing. So there's a lot of challenges, and that like primarily includes the formula that they're not continuously getting on a stable basis. So basically, like with the whole situation and with the whole Palestinian-Israeli conflict, and also with the COVID-19 situation, all of these made it very difficult for the Ministry of Health and for the Palestinian government to provide the necessary formula for these children. And you know, like if stopping this formula of the children means especially when they're little, means retardation and irreversible retardation even. So so the problem is there isn't formula for the children available all the time. The second thing is there's, and Dr. Raed was saying it, that there's like 50 years ago, the PKU disease was all figured out, and everyone knew what is this disease and how to treat it and how to deal with it. But until now, we're still suffering from that very basic necessary needs for a PKU child to survive. So, like, even the low protein food is still not available in the West Bank or Gaza. So we don't have enough low protein food, we don't have enough formula, and there's even a bigger problem with the testing, with the newborn testing that is happening right now in Gaza. And that is was what Dr. Raed is going to talk about more. كمل دكتور رائد.
مثلا لو أتكلم كوالد طفل مش كرئيس جمعية، وكزوجتي الإحساس بالخوف والقلق اللي بنعيشه في مثلا خلينا في نحكي بداية الكوفيد 19 من شهر 3 في فلسطين. لما سكرت الحدود، احنا الدولة لا بننتج الحليب ولا المواد الخالية البروتين، فكان القلق والخوف كبير جدا لأنه انقطع الحليب في بدايتها، ثم الحليب اللي توفر فيما بعد الأطفال رافضين طعمه ورائحته. نعيش في قلق وخوف حقيقي جدا على أطفالنا لما تشوف الطفل يعاني، غير متوفر الحليب اللي هو يمثل 95 ل 90% من غذائه، ما في طعام قليل البروتين، ما عندك خيارات كبيرة. تريد إطعام طفلك الغذاء الموجود، أنت بدك تخسر الطفل، ما بدك تطعمه، ما بتقدر تشوف الحرمان. فالخوف والقلق اللي احنا عايشينه لعدم توفر كل هذه اللوازم لأطفالنا المرضى قلق وخوف كبير وحقيقي جدا. نأمل في المستقبل إنه تأمن لكل أطفالنا المرضى كل ما يلزمهم ليعيشوا مثل أي طفل عادي ضمن الحمية الغذائية المطلوبة.
Okay, so Dr. Rad is talking from a parent perspective, of like he's a parent of a PKU child, and that meant a lot of horror and anxiety in these times, especially when the COVID-19 started affecting the whole world vigorously in last March. At that time, like he's just describing his experiment and the experiment he faced with his wife as well, like both parents having a child who is affected by PKU, and they are as parents cannot provide for their child the necessary food and formula for him to survive. Like that was so like anxious and like suffocating for them as parents, and to watch their child suffer the lack of all of the low protein food and formula that he currently needs, or else he's gonna go through mental retardation, irreversible mental retardation. So we really hope that like this problem might get to like some kind of solve, like some kind of solution, to like to make this end, like, and get sustainable formula like all the time, like for the formula not to stop ever. دكتور رائد كمل، بدك تحكي عن غزة؟
بخصوص قطاع غزة الوضع أسوأ من الضفة الغربية، حنكون صادقين. بالبداية احنا عندنا عدد أطفال في الضفة الغربية 340 طفل تقريبا، في غزة 235 طفل. الوضع في غزة أسوأ بالظروف اللي هي واقع فيها غزة من الحصار، من الإغلاق، الوضع المادي والحصار الاقتصادي كبير، والعجز اللي حاصل في ميزانية السلطة ممكن لتوفير كل ما يلزم غزة. فأطفال غزة بعض الأطفال من سنة تقريبا ما توفر لهم الحليب الفورمولا. حتى الفحوصات السكرينينج من 3-4 شهور تقريبا ما انعملت بسبب عدم توفر الدعم المادي أو توفر المواد الخاصة بهاي الفحوصات. ترجم.
Okay, so Dr. Ride is talking about the situation of PKU children in Gaza district. So the situation in Gaza is even much more worse than the situation is in the West Bank. Like for them to be like excluded and like you know, there's West Bank and there's Gaza, but the people of West Bank and Gaza are not communicating with each other. There's no connections between them because of because of the Israelis. Like it's not like you can't like no one from Gaza or from the West Bank can go to either. So they are like they have a certain political party that is that is not cooperating, let's say, with Israel, and that makes them like kind of in a really bad situation, and which will make them be uh, like uh, like like banned from a lot of their necessary needs, and that includes the formula and the food, the low protein food. Gaza has not been able to get formula for almost a year with no formula whatsoever. Um, they also don't have low protein food, definitely, and like being cut off formula for this really long time can really have a lot of impacts. And we did hear about children that are affected with PKU and they have died because they did not get the necessary formula. Um, and this is just like the basic needs of the PKU children in Gaza. Like the other problem that has been going on for like the past 4 months now is the newborn testing. The newborn testing has stopped since like 4 months ago. Like no one of the newborns is getting tested at all, and it's all because of the lack of the of the testing kits that is necessary to do these newborn testing. So the Palestinian government cannot provide for them, and we are facing a really big problem here because like still in the West Bank the situation is bad, but at least we do have testing. But the situation in Gaza is much more worse than the situation in the West Bank, that they don't even have newborn testing, which really makes it like a catastrophe, honestly. كمل
So,
دكتور رائد ولا خلص؟
خلاص
we
يكفي. Thank you.
Yeah, thank
Okay.
you. And we'll be taking some questions and some comments in a minute. We entered into what we thought might be a crisis with the medical food to Gaza and to the West Bank. The crisis in the West Bank is that there is some formula being delivered, not a long-term solution, not a year's worth, but week by week. But it's the different one from what the children had grown to be used to. So there's a rejection of formula, and that's really severe. Paula, who's an occupational therapist and studies and then worked in the therapy around food rejection, has written a paper, a description of what this is like when children just say no. And the parents on the line have often said, there's nothing quite as stubborn in all the world as a PKU child when they don't want to eat. So kind of important, it's very tangible, but it's very, very immediate. In Gaza, though, what we knew there was a problem with shipments. We didn't know how big of a problem it was. We knew that there was a gap. We didn't know how long of a gap it was in the delivery of medical formula. Rebuilding Alliance is good at gently embarrassing other players to do the right thing. So the moment we announced our fundraiser, the Ministry of Health delivered to infants, and also Palestine Children's Relief Fund delivered formula to infants. What we learned and heard over the last day as we called the families with children over 3 is that they haven't received formula for more than a year. And that's where we're hearing that some children have passed away, that others are, that families are trying to make do as best they can. But this is the only preventable form of mental retardation. If you don't get the formula, the opposite happens. So that's one depth of crisis that is just really overwhelming to hear. There's another part of it, though, which was that Dr. Red learned that the testing isn't happening in Gaza. The testing of all newborns since July 1st has simply stopped entirely. That means 6,000 babies a month, the usual tests that everyone in the world takes the moment a child is born, none of it is happening. And now we're, carefully finding our way to exactly what's needed, what kind of assays. The machine is there, the blood has been drawn, they're missing the assays that can run the machine on a special card. We found the manufacturer last night, and we found 3 suppliers. Our new board member is going to be seeing if we can get them donated. We're calling everyone we can. This is not just the scale of our medical food at $250 per child per month. This is now a few 100,000, 100,000, 105,000 to get them caught up. But then the next few months is going to be more, as well. So that's where we need a lot of creativity and determination. And, we look forward to your thoughts and your comments. Questions. I see that there's quite a bit of discussion in the sidebar in the chat. One question that's being asked is about the supply and maybe about the delivery, but I'd like you to go ahead and ask out loud, and we're happy to respond. Any of our speakers or others on the line. You can go ahead and unmute yourself if you have a question, and otherwise I can read some of the things that have been written in the chat, or just raise your hand. Go ahead.
Hello, everyone. This is Wafa from the Agriculture Foundation. It's a pleasure meeting you all. I'm the one who actually mentioned some of the comments on the side about the formula, and I was just trying to see where you are in terms of looking into this situation for a solution. So I just want to know, what would be maybe our position in case if we need to help, how we could build alliances that it could support the, the issue. But then at the same time, if we know, because we have really implemented the program in a different country where we collaborated with pharmaceuticals, within the country. And they were an amazing level of support to really deliver solutions like this. So that's one of the questions that I have really implemented or I have been asked about. And then I suggested the NAMA because the National Arab American Medical Association, they usually do symposiums all over the world, and then they address certain situations, and it's who it will be better than this organization to really address the PKU and see if there is something can be done in collaboration with what you are doing right now. And then I was asking also about the formula. I mean, do you know what is the formula itself? And maybe there is something, as I said, we can do about it. Thank you.
Thank you. So maybe to address the question of the formula, Sarah or Dr. Kimberly, would you like to speak to the types of formula a little bit more?
Sarah, I'll let you handle that.
Oh, yeah, sure. I can speak a little bit, and then, Donna and Kimberly have really been the masterminds behind much of what's being discussed from identifying the issue and then, forced to be reckoned with. But so the formula that we're talking about is all of the necessary amino acids minus the offending amino acid called phenylalanine. There are a few different brands, but the one that's the brand of choice from the children is called phenol-free. And there's a phenol-free 1, which is for ages from birth to age 3, and then phenol-free 2 is for over the age of 3. And so that's really the formula that we've been focused on purchasing. I noticed there were some questions and comments and chats about availability in pharmacies. I think in the West Bank, it's pretty, except for COVID prior to a Ministry of Health contract change, it was fairly freely flowing. But then COVID and some contractual issues really put a kink in the system. And then in Gaza, it's been, we're finding out many people have been years without the formula, which is just detrimental. I mean, it's been over 50 years since the treatment for PKU has been well known and established. So, I mean, these kids in Palestine deserve every right to access to the formula and low protein foods that other kids in other parts of the world have.
So what we did was we purchased from the supplier in Palestine. And for a while, we couldn't find the supplier. There's been a change in companies, representations. We worked with Palestinian, with the Physicians for Human Rights Israel, because there's got to be PKU kids in Israel too. But there's, all kinds of preventative agreements for shipping and transit and representation when you're buying and not buying. So it proved to actually we've got a good price from the parent company of Mead Johnson, which is the company in Indiana that produces this important medical food. And they remarkably, on how did you get it into Gaza? We're good at getting things into Gaza through that blockade. We sent 35,000 solar lights through the blockade. We know how to do this. We know how to do this probably all the way back to how we learned about it was on the flotilla when we were the ones who were the only ones to send cargo. And what I wanted to say about the shipment, this was probably our easiest shipment ever. That we ordered. As soon as our funds transferred from Global Giving, we placed our order, having researched all the details. We placed our order, and a week and a half later, it arrived in Gaza, and it arrived in the West Bank. So, and the numbers were correct. I always have my 1 a.m, wake up call of it's arrived. And I'm like, no, count, everybody count right now, count, make sure it's there, just make sure send me the pictures. So we got through all that, everything counted out right, it worked. That's why we think we can do that consistently. How though, will we do a consistently, we have 574 children as far as we know, not counting the new babies, which should be about 2 to 3 a month. So how are we going to support a $250 a month habit? We can't really, those governments have to step in at some point. Right now, they're disabled and their ability to talk with each other isn't working very well either. So we will be launching after this matching grant. This particular organization, One Day Wages, is considering continuing their match on a recurring donation basis. They've never done that before. They want to be impressed by our ability to come through with this first match. But we are creating a new program called Together We Can to be able to do recurring donations. And the next match is Global Giving for recurring donations starting on December 14th. So we're at least lining this up. And then let's see if we could do teams of 5 people each. If we all donate $50 a month, we'll cover 1 child together, with a team of 4 more people. So that's our plan on that side. And also you mentioned, Wafa, about partnering. Yes, of course, we'd love to partner. Everyone who can ever reach us, you're welcome. Anyone here is welcome to join our Sunday morning meeting. And even without joining the meeting, we're glad to follow any leads you have. More questions and thoughts?
Donna, if I might just comment about, there was a question about other treatment possibilities, including holistic treatment possibilities. And I just want to emphasize that the foundation of treatment for PKU is diet, which is in and of itself a holistic treatment, right? So it's a low protein diet. But in that low protein diet, and I think this might have been discussed before everyone was able to join the call, because the children and adults with PKU cannot eat most foods with protein, they're lacking in all of the other essential amino acids that are needed for the body to function. And so that's the role of the medical formula, is to provide those additional amino acids to allow for the important needs that those are used for in the body, including building muscle mass, including functioning of other enzymatic processes, including, for example, developing neurotransmitters in the brain, which contributes to mood functioning, et cetera. So that is the basis for treatment. In terms of additional treatments for PKU, because there are different genetic variations of the PKU condition, some people can be treated with an oral medication that helps to support the function of the enzyme that doesn't work. And but some people have a genetic variation of PKU that doesn't respond to the oral treatment. Currently, that medication is fairly high in cost, and so it's not currently it is currently cost prohibitive for most people, even in this country. And then again, there is another injectable medication that can also be used for certain forms of PKU, which is even more expensive than the oral medication. But depending again on the type of PKU that somebody has, they may still need to, even with the oral or the injectable medication, they would still need to follow a low protein diet and often still need to use formula, although they might not need quite as much if they were using the other types of treatments.
What is PKU stands for, number one, and to Dr. Raed Hindi, شو الاسم في العربي? And the second question is for Donna. We really need to do something about publicity to say your your 250 will do this, your $50 amount you do. I mean, we need to make it small where people can say, I can support. I'll call you back. I'm on a Zoom.
So answering about PKU, were you asking Dr. Rod in particular, or you?
No, I want in English, what's PKU stands for, and what is it, the word for it in Arabic, how this disease. And I wanted for us to sharpen our publicity about the support, because maybe Wally and I can support a child or for 2 months or so. I don't know. Go ahead.
Maybe Amjad, you could ask Dr. Raed about how do you say this in Arabic, and Phenylketonuria is the.
Okay. شو باللغة العربية المرض هذا؟
نفس الإنجليزية فينيلكيتونيوريا، هي معربة فقط، المصطلح الإنجليزي معرب تعريف فينيلكيتونيوريا. Okay.
And in English?
Phenylketonuria.
The same.
Okay.
Luckily shortened to PKU. Agata, do you want to comment a little bit more about the extent? I see the note about it's not about vitamins. You might just explain that.
Yes, I'm sorry. I'm trying to type with my cat on my lap, so it's always more difficult. The basic idea behind the formula is that I told it's not about vitamins, not that much. So the extent of restriction of the diet is such big that the formula is basically the main source of food, okay? So let's say that daily necessity, I've got it here, and it's just my blend here, okay? It's nice, it's pina colada taste, it's better It's a new generation treatment. It tastes all right. So let's say this is like the 80% of the nutritional intake I get every day, okay? Because my diet lacks all of the amino acids, which, amino acids, when metabolized, go to the brain, they convert in neurotransmitters, so dopamine, serotonin, everything. Then they build muscles, as Kimberly said. Yes, they are fatty acids, which I lack in my diet because I don't fish or eggs. Many micro elements, and the tricky part of the formula is that it has to be correctly balanced to, in a way, supply and imitate what I would eat if I could. Okay, so it's about measuring the correct intake of each amino acids, of fatty acids, of everything. And the sugar that goes there in the first place is that we are able to drink it, because it's not really palatable, so to say.
Agata, this is a journey for life. There's no solution for it. Is that correct?
Uh, for the
I mean,
moment,
when we have it as a child, it stays with us as adult?
yes, it is. There was a moment when we believed that we could interrupt treatment once the brain is developed. So there are people that are a bit older than me that actually stopped the diet. They went off the diet, and after several years, they came back with attention issues, depression issues, anxiety issues, really strong mental conditions, okay? And once they got back, they got better because the brain stopped being intoxicated, but some damage has been done already, okay? So now we believe it is for life. There are other treatments, as someone said, but they are not approved worldwide. And then because PKU, as Kimberly said, is such a individual condition, there are like, I don't know how many mutations, but be it 950 that I know of. So each person responds individually to the treatment. So there are oral solutions, Kimberly said, there are injections that seem to work fine in many people. There is gene therapy going on, being developed right now. But of course, it is something that has not been approved worldwide, and it's much more expensive than the standard diet, and can be only done after an extensive study of the patient in question. Yeah, so it has to be done with a strong team of doctors to recognize that there are more benefits than damage. Yes, if you introduce this treatment, the diet is something that has been proved to be the most effective.
So I want to mention about publicity. We are working on an article for the Lancet because we've got to raise this bigger than than getting stuck at these government levels. And also, you're right, like anything we can do to market effectively. So you'll be seeing very soon, Together We Can, PKU-togetherwecan.org website entirely devoted to this, so that we can work together as donors, on that, what does $50 buy? It buys the 6 cans of food together with enough people joining in, 4 more people, that would make it. So we'll be doing more of that. You're seeing it a little bit on the Global Giving site, and now it'll hopefully on this One Day's Wages, where we have the matching grant for up to $30,000. That'll give us our next 2 weeks of formula just for Gaza on that one, just because that need is so huge. And yes, it's a start. It's not persistent yet. We will have to get it to sustainability.
Maybe somebody in your staff can get in touch with the lady that was speaking about maybe NAMA can put this project in their website, and all these medical doctors all over America, maybe they can pitch in.
Absolutely. So Wafai, we'd be delighted to be in touch with you, and also like help us think about how what you mentioned about pharmacies partnering with around the world. That would be great.
I would be happy to do that. I don't know if you want to do it like
Wafa.
like off the record. I guess we can discuss that. You could reach me out. I'm gonna write you my email right now,
Great.
Um,
Great.
so you can reach me anytime.
Sure, let's do a follow-up call, and you know we'd be glad to do webinars, seminars, and we're happy to share information and certainly ask for everyone's help on it. Um, it that would be great. The thousands of Arab American MDs in Nama would be really great to connect with, of course.
Exactly, because it will be a great partnership, and there is a lot of Palestinian doctors, among the
Yeah.
Nama. I'm pretty sure that they will be more than happy to take on a cause like this. And I'm not sure if they have ever done any symposium or any major events, for the Palestinian community, but in Gaza, but it is something that it's worth really opening the conversation with them.
That's great. We've been
Yeah.
working with hospitals in Gaza, by the way, on COVID relief with the NGO community. So that's another strengthening point that we do have these very strong partnerships. And one more thing I want to mention is that with the new administration coming in, there is an effort to have aid restored for medical emergencies, especially. Congressman Pocan is inviting a webinar on December 3rd, which will include discussion about Gaza, about COVID, and also we'll put in about the PKU situation. And this is the first time, though we've done many webinars with Congress briefings, this is the first time where the congressman is introducing us. So also a good thing. We can look at that side of the picture.
Donna, there was a question earlier in the chat about whether the Israeli blockade was also limiting, it was specifically about supplies related to PKU coming into Palestine or Gaza, but I think maybe
think so.
even...
I don't see that as the big problem here. Oddly enough, at the request of the American Embassy, I was assigned a liaison from the Israeli army to help us with supplies crossing. And we haven't had to use it for this. Really, that part of it seems fine. There's a different side to it, though. It has to do with the inability of the governments to talk to one another and the lack of funds overall. Just they have a medical emergency. We're distributing those cans of formula throughout Gaza starting tomorrow. Our planning process today was to describe how that's going to happen. They're breaking 1,000 new cases per day now in Gaza City.
How many family would be receiving or the shipment right now? Would it cover all of the people?
It'll cover, our shipment was all the families with children over 3, about 260, and about 2 weeks supply that was what we were able to ship right now. And we chose that because the babies got the other formula and the babies got a boost from PCRF. So, just very carefully and judiciously choosing who was left out. And those are the families we're focusing on.
And that's really what I was gonna ask is like, what has been the position of the PCRF and also the UNCHR or the UNRWA, perhaps? What has been done in regards to
Everybody's facing a crisis. So PCRF declined to continue because they're really focusing on their fundraising for a hospital and equipping a hospital. So they're not a logo on our, and they're not co-sponsoring yet, but they will in the future, they said. I wrote to the World Health Organization, and we should be hearing back from them. UNRWA, I wrote to about 2 weeks ago. As you know, UNRWA has its own crisis and can't pay its teachers. They I don't know, 80% of the babies born are in UNRWA hospitals and facilities. All of the blood has been drawn. It just is not tested. I checked with our NGO hospital partners. Could we move the testing to them? You can actually get a machine donated. You can get a machine donated, then the test kits might be, I don't know, there's another possibility. But everyone said, no, leave it with the government test lab. This is population, like this is the identity of, it's the registration of each child that goes along with the results from their medical tests. So you don't actually, it's not just about testing, it's about data as well, and separating it from the center that registers birth certificates. That's not what you want to do. So we're going to have another hurdle if we solve that test kit problem. Just my experience in delivering backpacks and school supplies is that when you cross the line into a government facility, you're crossing the line in American law. But let's get to that point, because we're going to test it out by asking everybody's help to make sure that those test kits can get through. Once we know how to get them there, well, like once we have it identified, I'm sure we'll make it happen, or we give it to another government, the British, someone else who doesn't have this barrier.
Donna, can you just repeat what you had said about the role of the Palestinian Children Relief Fund? There was a comment about that in the chat.
So, I mean, they've done a really great film about their commitment to the babies and to the babies with PKU. And they did deliver their formula just in September, end of September is they delivered to the babies. So they have been supporting a portion of the population, and great, all good. That's why we took on the children over 3. It's not clear to me, how constant that support will be going forward based on their message. But they did get back to me right away, and they do say they would like to work with us as soon as they can, as soon as they have a moment when their other fundraising is calmed down. So that's the challenge on their side. That's about all I can say about it so far.
And Donna, I believe there was another question in the chat about the number of, I'm not sure if the question was about COVID cases or PKU cases, but I think it was about COVID cases. I don't know if Dr. Amjad or Dr. Rayed have information about that.
So it's a question about the number of COVID cases in the West Bank and Gaza?
Right. If there's any information about number of COVID cases since the inception of COVID, and then you had mentioned that currently there was 1,000 new cases being diagnosed daily.
So I'm following 2 sites, the government site and the World Health Organization site, and I'm more than happy to share those numbers. And Dr. Rad and Dr. Amjad, what's your experience? What are you seeing about COVID numbers? What's happening on your side in the West Bank?
Like the COVID-19 cases has been increasing a lot lately. Like it has been stable on like 500 to 600 cases for like the past about 3 months, but like starting from since last week, it started to rise to 1,200 cases each day. So it's even starting to rise more. Like even the Minister of Health herself said that the actual number of COVID-19 cases is multiplied by 3 of the numbers that are announced. So there's actually about maybe like 3,800 cases that is being like happening every day, but like there's no enough testing to discover all of these cases. So I think like the number of cases overall is like the number that is on the World Health Organization website. I guess it's like 74,350 cases since COVID started. And there's like 633 deaths.
Is that both Gaza and the West Bank?
Yeah, both Gaza and the West Bank.
Gaza, way back in July, had 13,500.
So here's what you're seeing. What our experience with our NGO partners in Gaza is nobody's counting. There really isn't the testing that needs to happen. The Minister of Health is entirely accurate to say that these numbers should be times 3. Active cases today, we're seeing this number edge up past 900 in Gaza. And look, our team is on the ground there. They are being exposed. Families are coming down sick, especially in the Gaza City area. We've got an employee quarantined. We're sponsoring 2 hospitals that are coping with this, and in touch with them because they'll be speaking on Representative Pocan's webinar coming up. So these numbers are under tested, like they don't have the resources to test. It is extremely serious, and you know, that we're really hoping for great social distancing. We're arranging for deliveries of formula to the families, which is still available, allowed by NGOs that get special permits in Gaza to make that happen. Dr. Raed is going to be distributing to Hebron, which has had a huge outbreak and large numbers of active cases, but also Nablus has been running up lately. So these are all of very big concern.
Donna, why don't we ask anybody that is on to ask any question about our subject, PKU. We need to see if anybody have questions in that area.
Yes, absolutely. Any more questions or thoughts about ideas about PKU, how we can come around and take on this very big challenge? And I know that we've got people from good parts, quite a representation of the country too. So if you'd like to, mention your thoughts about our webinar today in closing, otherwise I can go toward our speakers who I'll ask in a minute for their closing remarks. Did you find it worthwhile? Why don't you go ahead, anyone who's joined us as a guest, let us know your thoughts, and also you're welcome to be back in touch with us as well.
I would say that was it was great awareness, to hear about what's happening there. I think no child should really be suffering from, malnutrition or going hungry or not be able to have access to medication or solutions for their medical conditions. So I think this is important. And from my end, I would like to know if there is any pharmacy that it's local that we can reach out to, and then we can implement a program where maybe we could call it like a pilot program, so we could see what we could do to help some of these families. To let me know, and shoot me an email, and if you can provide me with that information, and then we can discuss what can be done and how we can.
Are you thinking like pilot program from local pharmacy there in say Bethlehem or in Gaza City?
Well, I mean, like pharmacy usually also that they will have access to like whatever manufacturing, like I know that you purchase directly from the manufacturer, which is great. But, you want to also like make sure that you're providing, like I don't know how the process between when the doctor, provide a prescription, is that by prescription or not? I am not sure, how that formula is being provided. Is that some like from off the shelf you just go and buy? If you could kind of enlighten me on this?
Sure. Would someone,
Maybe Dr. Raya could help us with that.
Dr. Riot, is it a prescription? How did people, once they know that their child has PKU, how is the formula decided for them?
دكتور رائع تسألك إنه لما بالعادة مثلا يكتشفوا إنه الولد مصاب في البي كي يو، شو البروتوكول اللي بيتبعوه مثلا عشان يحددوا لهم الله شو الفورمولا اللي بده ياخدها، أو قديش بده ياخد فورمولا، أو مثلا كيف بطلب الفورمولا أصلا؟ يعني هل في لها وصفة طبية مش وصفة طبية لما تشتريها من الصيدليات؟ يعني هيك.
اوكي. بالبداية الفورمولا ما بتنباع بالصيدليات، غير متوفرة بالصيدليات أبدا، هي فقط متوفرة عن طريق وزارة الصحة الفلسطينية توفرها مجانا للمرضى. بالبداية خليني أحكي تجربتي، أنا مش مطلع على البروتوكول تاع وزارة الصحة الرسمي، لكن كتجربتي وتجربة الأهالي الفحص بنعمل سكرينينج على اليوم بعد اليوم الثالث لولادة الطفل لليوم الخامس تقريبا، خلينا نحكي بعد أسبوع تقريبا بتطلع نتيجة. إذا كان الطفل مصاب بكيو بيتم التواصل عن طريق وزارة الصحة الفلسطينية مع أهل الطفل، بيحضر الطفل لمركز وزارة الصحة للعيادة العيادة، بأخذوا كمان عينة يتأكدوا من فحص القدم. إذا كانت النتيجة إنه مرتفع الفنين اللي عنده، بيعطوه الحليب، ببلشوا معه بشكل تدريجي، ما في بروتوكول يعني. بيعطوه مثلا أول يوم معلقتين حليب بيحكوا له، والأم تخفف الحليب الثاني سواء الأم أو الصناعي. بعد 3 أيام بيعيدوا الفحص كمان مرة، ضلوا يعملوا هيك تدريجي، يزيدوا الحليب ينقصوا الحليب حتى يصلوا للنسبة تكون نسبة المعتدلة. بعدين بيمشي الطفل على نفس السيستم. الفورمولا هي واحدة فقط، بكون شريتها وزارة الصحة، عطاء كل الأطفال نفس الحليب نفس الشركة، يعني ما في فورمولا بتختلف عن الثانية إلا الأقل من 3 سنين والفوق 3 سنين. طولت عليك بعرف.
مش مشكلة. اللو بروتين موجود في الصيدليات ولا برضه مش موجود؟
اللو بروتين مش موجود بشكل كبير، أصناف قليلة جدا، وممكن هي بتكون إحنا في شيء اسمه فري جلوتين، بتكون أوقات لو بروتين، مش كلها يعني، أوقات بنستغل إنه في شيء لو جلوتين بيكون له لو بروتين، أما للبي كيو بشكل خاص ما في.
Okay, so basically the process of like the first moment, like the Ministry of Health discovers that this child has like increased phenylalanine levels. They call the parents and tell them that your child has increased phenylalanine levels and you have to like get him back to the clinic to double check. So after 3 days, they go to the clinic, and they draw blood again and like make sure he does have increased phenylalanine levels, which means he has PKU. And like after that, they give him the formula, which is not available in pharmacies, by the way. Like no formula is available in the pharmacies at all. Formula is only supplied, or like it is only given by the Ministry of Health. No one else has the formula. So what basically happens is that the child goes to the doctor that is responsible, who is not a specialist of metabolic diseases, by the way, and PKU is a metabolic disease. And this doctor gives or like tells the mother that like to start giving her child the like a certain amount of the formula, and she starts giving him, and at the same time like the mother or the father brings the child to the labs to test him every day and see how the phenylalanine levels
كل
go
3
up.
أيام تقريبا، مش كل دقيقة، كل 3 أيام.
Oh, okay. So every 3 days, they bring him every 3 days to the clinic and test him for phenylalanine levels. If it's going up, it means he needs more formula. And on this basis, they give him more formula. If it's going down or it's going like further down, like they give him a less amount of the formula. And if it's just normal, this means like the amount of formula he's taking is perfect, and like he just stays on this amount of formula he's taking like the whole time. And you should know like there's two types of formula for children under 3 years of age and for children above 3 years of age.
برضه من ضمن التحديات اللي بتواجهنا في هذا الموضوع، بما انه طرح انه الفحوصات فقط تعمل في مختبر مركزي واحد في الويست بانك ومختبر واحد فقط في غزة. مثلا في الشمال او في الجنوب بيعمل الفحص بيرسلوه على رام الله، يعني بتحكي من اسبوع ل10 ايام تتيجي النتيجة. هذه المشكلة يعني في من ضمنها، يعني انه في وقت لازم انك تعرف النتيجة مرتفعة او لا تعود تعدل النتيجة.
Yeah, and Dr. Rad saying that like one of the challenges we're facing is that there's only one central lab for testing in the West Bank and one central lab for testing in Gaza, which means if you don't live in the city that the testing is happening in, you have to wait for like 10 days until until the test like goes to that like to that central lab and comes back with a result. So like even like there isn't even a dietitian who is well well knowledgeable of PKU and the diet that is like that PKU children should take. And there's no specialist of metabolic diseases that is responsible for the PKU profile in the Ministry of Health. So any parent that would like to check his child really well and like Dr. Raed, when he wants to like make all the testing for the child, he goes to Al Maqasid Hospital in Jerusalem, which is the only place that has like a specialist of metabolic diseases that can do all of the tests for the child. And that is very difficult to get to because, you know, Jerusalem is under Israeli forces. So you cannot get there without a permission from the Israeli side. And the second thing is that it is very, very costly to get to that hospital and go through all of these difficulties. So in the West Bank and in Gaza, there's no dietitian and there's no specialist of metabolic disease, which makes it like much more difficult.
And that was the scary news this morning as we were hearing about, 75 families we've called so far about delivery of the medical food in Gaza. And our team from Youth Vision Society there made those calls. So the list is old. Some of the families haven't received medical food for more than a year. And they said that they've been advised to have a different strategy, a diet strategy, it's possible that there's a misinformation, that there is no specialist, no nutritional specialist in Gaza. What are they being counseled? So we'll be learning more about that as we begin the delivery of the food. It makes it possible to engage with families, and hopefully even families who've made this decision not to continue on the medical food path. We would like to provide low protein food. Maybe as the governments get back on track, we can do those other pieces. And certainly training is going to be important. Getting nutritionists to train, being able to do a doctor's seminar so that we can up the level of expertise by the doctors in the West Bank, in Gaza, by the nutritionists in Gaza and the West Bank as well, so that families can be counseled. And one more comment was about solution sets. If we do find companies willing to donate testing equipment, then being able to get that machine sited, I mentioned about getting babies tested in the central hospital, but look, for the PKU children who need the continuing recurring testing, we're already partnered with the largest maternity hospital in Gaza. Being able to bring that test equipment to the private hospital system and provide an alternative source so that they can get what they need, that sounds really important. That can't be, that shouldn't have to be only one lab in each of Gaza and the West Bank. So
yeah, just to clarify that point, Donna, because what you're referring to is that the same machine that isn't working to test newborns to find out if they have PKU or not is the machine that would test any child who needs ongoing monitoring of their phenylalanine levels to be able to make adjustments to diet and formula. So that's not happening in Gaza now for months.
Thank you. Really important to have that. Well, I want to thank everyone. You've been on the call. It's an hour and a half, and I really appreciate your insight and your effort in this, and glad you could join us today. Let me ask for closing statements, if you would, and I'll work my way back to you, Reverend Fahed Abu-Akel, last. Agata, could you please make your closing statement, and then we'll go to Dr. Rad and Reverend Fahed.
My problem with Wally is going to ask me after this Zoom, did I pledge? I pledged publicly $50 a month, and I already sent something. So I challenge all of us to tell others about it, to get in touch with your office. I think we can do it. And I hope everybody will take the recording. You're going to email it to everybody, and then we take it to places. And if we can find, we need really to reach. How long you going to be working on the $15,000?
I thought we could do it in.
I mean, by the end of the month, or when?
Yeah, let's do it by the end of the week, if possible. We've already. Yeah. I'll show you. We're already up to 16,000 out of the total 30. But yes, they're giving us certainly till the end of the month and even longer if necessary.
Wafa can help us because she is with NAMA. Maybe she can tell them about this challenge. We really need to get the 15,000. We need to raise 15,000.
Exactly. And we're now just needing to raise 14,000. So thank you everyone who has been donating. This is the One Day's Wages matching grant site. And you'll hear more of the story of the two children who started this off with us, and then being able to donate here, much appreciated. Great. Let's go to you, Agata, please.
Hi. Well, I'm really happy to be here. I'm really happy to see all the comments and intense debate going on. I think that it's interesting to close it with what Wally has just said, that the lack of access to your health protection is a violation of a human right. This is a premise we've been working in association, and I do believe we are facing a crisis, which is also a crisis of human rights in the area. And that's why I believe that we need to commit to alleviate the situation. Thank you everyone for coming. I'm really happy that I could share with you this experience, and thank you for your interest.
Thank you. And let's go to Dr. Raed and Amjad. Dr. Amjad, please translate and add your thoughts.
دكتور رائد شو عندك كلمة أخيرة بتحكي لهم إياها؟
مرة بنشكرهم على اهتمامهم بأطفالنا ومحاولة مساعدتهم. نثمن الجهود اللي بقدموها. إن شاء الله نحقق فائدة لهذول الأطفال، نقدر نوفر لهم أبسط الأمور هي الطعام والغذاء اللي عشان كي يعيشوا حياة ليست أقل من أقرانهم من الأطفال، يعني خاصة لما يكبروا في مدرسة، روضة، تعليم، بيحتاجوا رعاية خاصة هؤلاء الأطفال. نتمنى أنه مساعدتهم مساعدة الجميع نحقق هذه الحياة الكريمة لهؤلاء الأطفال. شكرا لهم جميعا.
Okay, thank you. First of all, thank you very much for all of your interest in this subject. And like, we really hope that like together we really can help everyone and every child in the West Bank and Gaza to just live like a normal life, like to get the privilege of living a normal life, like just to get the very necessary basic needs of like a formula that can prevent this irreversible mental retardation from happening. And we really hope that you can reach out to all of the people you can, like, and all of the organizations that you think might help us get to a better place and help our children get brighter future. Thank you very much again.
Thank you so much. Thank you, Dr. Raed. Thank you, Dr. Amjad. Thank you, everyone who's been on the call. It is a dollar for dollar match from one day's wages. And if we can impress them with our ability to come through quickly, and we can place our next order as soon as we see us coming to the edge of the fundraising. We'd like to get that moving in another week. So
I'd like to mention something, if you don't mind, but the Agata Foundation would be addressing this matter seriously. So I just want you to know that, and I will be in touch.
Thank you so much. Tell us the name of your foundation.
Donna,
again.
do you have the email for WAFA?
Yes, I think I do. And I've been able to copy the chat, and you've also registered to sign up for the webinar. So I look forward to being in touch. Much appreciated. Deeply appreciated.
Of course. Guys, have a great day today.
Thanks, everyone. Take care. Best wishes.
Thank you very much.
Thank you.
Thank you.
Great. Thank you.
Paula, thanks.
Thank you.
Yeah, thank you, Paula.
Somehow
we'll stay in touch.
Together. Thank you. Very good.
Bye.
Very much. Goodbye.
Allah ma'akum.
شكرا.
Allah يسلمك.
Dr.
I was interested to hear your experience in Saida, you said.
Yes, yes. So I lived in Lebanon 14 years total. And I learned Arabic as a child, but haven't used it for very much. So it's very, very rusty. But I visited Lebanon in 1998 with my family.